Hello, welcome to another antibiotic primer. This one is a focused look at piperacillin-tazobactam, or sometimes abbreviated to pip-taz. This is an incredibly useful antibiotic to note. It's very broad spectrum, very useful for hospital infections, and it gives us coverage against Pseudomonas, which, if you've been watching these videos in order, Pseudomonas is the one infective agent that we haven't yet covered in any of the drugs that we've covered so far. Let's relate it back to the case that we've been building up. So this is of a young patient, no underlying health conditions, they've got a community-associated pneumonia, and they've been prescribed a variety of different drugs along the way. So vancomycin, azithromycin, ceftriaxone. The reality is that if they weren't really responding at this point, and probably before, you would have spoken to the microbiologists in the laboratory, and you would be guided by what they're telling you and what they found based on the cultures and the swabs that you've sent away and what they're coming back with. But let's say it's the middle of the night, someone that you're working with is really worried, and they say, this patient isn't responding, we need to prescribe a stronger antibiotic. Naturally, you've watched these videos and you think to yourself, well, and you say maybe under your breath, there's no such thing as a strong antibiotic, but maybe we need to be thinking about looking at our coverage. Can we broaden it even further? Or do we need to consider whether there's an antibiotic-resistant version of an organism that we thought we were covering, but it in fact turns out that we're not covering? This is where pip-taz can be quite useful. As drugs go, it's quite a bit more modern, and resistance to it is a bit lower than some of the other drugs that we've spoken about so far. So it can be useful at treating certain resistant strains of organisms. Let's go back to our chart. Up until now, we've done a really good job of covering a whole range of different organisms. You've seen we've got the gram-positives have been covered with the vancomycin, we've got atypicals covered with that azithromycin, we've had ceftriaxone in there. Amoxicillin was where we started initially. There is a gap, and that gap is Pseudomonas. We might, of course, be thinking about what's called an ESBL strain, an extended spectrum beta-lactamase, and this is probably where you would be speaking to a microbiologist at this point. ESBL strains are treatable, there are things you can do, but your choices are very limited, and often the drugs that you use to treat these infections are tightly controlled and restricted. But we might be thinking Pseudomonas, which is an incredibly tough organism to treat. Pip-taz is one of the drugs that you can use to treat Pseudomonas. Before we jump in, let's just think about exactly what pip-taz is. It's a combination drug. So in the same way that co-amoxiclav was a combination drug, here's another one. Co-amoxiclav was amoxicillin and clavulanate, or clavulanic acid, same thing. Here we've got piperacillin, so that's the antibiotic, with tazobactam. So it's an antibiotic, specifically it's a penicillin with a beta-lactamase inhibitor. The inhibitor effectively makes the activity of the antibiotic even better, and it actually broadens the spectrum out even better. Again, pip-taz is really useful for lots of hospital-acquired infections because, in particular, things like hospital-acquired pneumonia, where some of the causative agents can be quite diverse. With community-associated pneumonias, for example, generally speaking, you're thinking about kind of normal flora, normal pathogens of the upper respiratory tract. With hospital-acquired pneumonias, the kind of causative agents can be a bit more diverse, and so you may see this drug used a lot more. Certainly, as I'm making these videos in 2021, that's very much the case. But there's a couple of really key learning points here to say. The first is that piperacillin is a penicillin derivative, so you may hear it referred to as an anti-Pseudomonas penicillin. Occasionally, you'll get clues in some of the other penicillins about the things they work against. So, for example, flucloxacillin is sometimes referred to as an anti-staph penicillin. The other really key thing is just looking at their structures, and you'll see that there's a similarity. Both piperacillin and tazobactam both have a beta-lactam ring. Now, again, there's another parallel here with co-amoxiclav, because with co-amoxiclav, amoxicillin is also a penicillin, and the clavulanate that you're combining in there as well is also a beta-lactam. So the learning point is, as a reminder, that beta-lactam doesn't equal antibiotic. Beta-lactam doesn't equal penicillin. It's referring to this chemical motif found within the structures of the drugs that you're prescribing. And the really key clinical point here is that sometimes when people have a hypersensitivity reaction to a penicillin, what they're actually getting is a hypersensitivity reaction to this beta-lactam. And what that means in this combination drug, we've got to be thinking, does this person have a penicillin allergy? Is it a true penicillin allergy? Because sometimes people over-report their allergies. But also to note, tazobactam can sometimes slip through the net. Because it doesn't end in -cillin, people sometimes miss the fact that it's a beta-lactam, and it can be prescribed to people with a penicillin allergy. So it is a really important thing to say. Think penicillin allergies and be mindful of learning those suffixes to drug names. Things which end in -cillin aren't the only beta-lactams that are out there. So think penicillin allergy. Let's move on. Let's think a little bit about the spectrum of activity of pip-taz. It's, as mentioned, an incredibly broad spectrum antibiotic. That's useful if you have an infection where you have a potentially quite wide range of different causative agents. Here, it also gives us coverage against Pseudomonas. What does it cover? So it works on some Staphylococcus strains, so specifically the MSSA versions. If you had an MRSA infection, you wouldn't be turning to pip-taz. It works on strep. That's good. We've got a chest infection. It does work on Enterococcus, but Enterococcus is a bit funny that there are variants which seem to resist pip-taz a bit more. So it wouldn't necessarily be your kind of first choice here. But again, thinking about the case with a respiratory tract infection, it really wouldn't be an important organism or as an important organism to be thinking about. Where pip-taz comes into its own is with the gram-negative. So it works on the enteric gram-negative rods, it works on the respiratory pathogens, and it also works on Pseudomonas. And that's the thing, if you've been watching these videos in series, that's the thing that's been missing. It's a beta-lactam, it's a cell wall active antibiotic. It won't work on atypicals. What it will do is it will work on anaerobes as well. So it's very effective against oral and GI anaerobes. Though, of course, and this is another really important learning point, if you had an anaerobic infection, you wouldn't necessarily be turning to pip-taz straight away. If you knew you had an anaerobic infection just caused by these organisms, you would probably focus in and use another antibiotic that only works on anaerobes. Why? Because when we're thinking about the spectrum of activity, it's incredibly broad. Here it is. So we've added pip-taz onto our other antibiotics that we prescribed up until date, or to date. And look just how wide it is. So we're killing lots of gram-positives. And I say killing, this is a bactericidal antibiotic, and also lots of gram-negatives. We've got to be thinking, though, it's not just about the pathogens. Pip-taz is also doing quite a lot of damage to your normal commensal gut flora as well. And so when we're looking at charts like this and we're thinking and we're identifying antibiotics which are very broad spectrum, yes, they're good at covering organisms that you think might be causing an infection, but think about the side effects as well. So here, we're really using this drug because we're thinking, could it be a Pseudomonas infection? But in the back of our mind, we've got to be thinking about, is it really a Pseudomonas infection, or are we dealing with something else that maybe has slipped through the net because it's a drug-resistant version? And that's always in the back of your mind. I'll say now, treating Pseudomonas is tricky. It's a very difficult organism to go after, and there are very few antibiotics which work on it. There are very few antibiotics which actually kind of allow you to kind of focus your activity in. So often you have no choice. If you really think you've got a Pseudomonas infection, you're probably going to have to prescribe one of these very broad spectrum antibiotics. But do we? In this case, do we think Pseudomonas is the causative agent? And is pip-taz really needed? Many of us acquire Pseudomonas from the environment, and it's an organism which you may well have been exposed to, but your body fought off because you need underlying health conditions to actually get Pseudomonas infections. And these could include things like prolonged healthcare stays and settings. You can get nosocomial infections caused by Pseudomonas. So that might be where you've been exposed to other antibiotics, lots of antibiotics over a period of time, and it's created a condition for a Pseudomonas to kind of cause an infection. Or there's another reason why you're in hospital, which makes you susceptible to an infection. Cystic fibrosis is really important. So when you're thinking cystic fibrosis, you should be thinking chronic lung infections, and Pseudomonas is right up there. There are other agents, so there are other bacterial agents like Burkholderia, for example. There are other fungal agents like Aspergillus, which can cause chronic infections, but Pseudomonas is right up there. You're thinking hospital-acquired pneumonia as well, and that's where pip-taz is useful. Pseudomonas can form a biofilm, so it can complicate infections of plastic tubing. So that's something to be mindful of, and also diabetes. So, for example, infections of the foot can have a complication of a Pseudomonas infection as well. The point is that there are underlying health causes which make you a bit more predisposed to a Pseudomonas infection. And in the current scenario, the child doesn't seem to have any. So we're thinking, really, is pip-taz needed? And is there an alternative? Really coming back to our spectrum of activity, this is a really good example of antibiotic stewardship. We're not just putting someone on an antibiotic because we're actually kind of thinking things through in our head, and we're thinking, do we actually think that this drug is needed? What do we think of the causative agents? And does this person really match the profile of someone with an infection from Pseudomonas? Well, no. There are other agents you can switch to which don't give you coverage here. So, for example, piperacillin-tazobactam, which is sometimes called Unicin, is nearly identical in its coverage, except that it loses its Pseudomonas coverage here as well. But there are other drugs which are used, if we're thinking about the antibiotic ladder, are about the same rung, and that will be another video which we'll go into. And specifically, instead of pip-taz, you might be thinking of a cephalosporin, so specifically cefepime can be used if you were really worried about a drug-resistant form and you needed to attack the infection from a different angle. So that's the key thing. Next video will be dealing with cefepime. And as always, remember that this scenario is a little bit of a make-believe scenario. You would nearly always be guided by this point with a conversation with a consultant microbiologist and also speaking to the laboratory. Thanks for listening.